Hey guys, Miss G again, and right now I'm going to teach you all about denture care. So for this skill, I just want to remind you all that we never touch the sink because it is considered to be contaminated. So we're always going to use a clean piece of paper towel, and we're always going to keep our body away from the sink as well. We don't want our scrubs getting contaminated. So the supplies that we need. We're going to go into our patient's room with our indirect care, with our knock knock, hi, my name is, can I get your name and date of birth, sanitizing my hands, pulling my curtain, and putting on my gloves. You're going to go into their top drawer where their emesis basin is located. That's where you're also probably going to find their dentures in their denture cup, along with the denture toothbrush, their toothpaste, and any of the other supplies that you need. So let's get started. I'm going to put on my gloves. Oops. If that happens, you're going to remove that glove and go ahead and just go grab another one. Here we go. All right. I went in my patient's top drawer and grabbed my supplies that I need. I'm going to take my paper towel and start lining my sink because just like our bedside tables, we need to have a barrier. So you are going to line the edge. Carefully fold that over like that. And you also are going to put a couple paper towels in the bottom of the sink, and that is to protect the dentures if you drop them. We want to make sure that they are protected. You could also use a washcloth if possible, but that really slows down the sink from draining. So now I have my barriers down. I'm going to go ahead and set down my emesis basin. Using a clean piece of paper towel, I'm going to turn on the sink. We want to make sure that we're using cool water. If the dentures are soaking in cool water already, you're going to go ahead and empty that. Get your denture toothbrush ready. And they look like this. They have two sides. So you're going to add toothpaste to both sides of that stick. Good. Okay. Grab your dentures and very carefully start scrubbing them. You want to get all surfaces of the denture, so the top of the palate, all the way around where food tends to get stuck. You want to get the teeth, the insides, the outsides, the top of the palate as well. The roof of the mouth. Scrub, scrub, scrub. Get all the way around those teeth, making sure to get out any leftover food particles. Very good. Okay, now you're going to rinse. While you're rinsing, pay attention for any chips on the dentures or any type of things that should be reported. If you see any spots on the dentures that still have toothpaste on them, go ahead and scrub it a little bit more. We want to get rid of that. Good. Okay, now that they're all rinsed, we are going to place these dentures on the clean paper towel surface that we placed on the side of the sink. You're going to grab your denture cup, and now you are going to scrub that as well. We got to make sure that this is nice and clean for our dentures to be stored in. Okay. If you ever need to add more toothpaste to the brush, you're always able to do that as well. Okay. Now that my denture cup is clean, I can place the dentures back in there, and I'm going to fill this up with nice cool water. Set this back down on your clean paper towel. Grab the lid of your denture cup and scrub that as well. Rinse it and go ahead and cap it. Okay. Rinse the denture toothbrush, get all of that toothpaste off. And place it in your emesis basin. If your emesis basin starts to get wet on the inside, make sure that you always dry that out. We don't want to be putting that back in the drawer with water inside. Okay, with one hand, you're going to take your emesis basin, place the denture cup inside of it, and with the other hand, you are now going to turn off the water with a clean piece of paper towel, and you are going to remove all the paper towel that you place around and in the sink. There you go. Okay. You're going to take this back into your patient's room and put this in the top drawer. Make sure that you don't touch anything with this hand though, because you just touched all that nasty paper towel. So into the top drawer. Now you're going to remove your gloves. Ooh, that one broke. Sanitize your hands. Make sure that your patient has their call light and water. Open up the curtain and go see your next patient. Have a good day.